Do you suffer from chronic pain conditions like, neuropathy, and maybe you have problems of burning that's in your spine, or headaches, or chronic fatigue? I'm with a patient of mine. My name is Dr. Lonnie Herman. I'm with a patient of mine, Mr. Fisher, Darren Fisher, who flew down to my clinic in Florida from Alberta, Canada?
Yep.
We're in Alberta, Canada. Thank you.
Good guess, Doc.
Different time zones, thank you. Different time zones, and on another side of this continent that we're on. So, people can come from all around to experience relief finally from their chronic conditions. And we're just going to merge this. I'm sorry, as I'm talking here, we're going to merge this with the last video that I did and make it sort of a timeline of what we're going through with you. And Mr. Fisher is very active in the Lyme community and has been tested before with various methods and various treatments and everything, and nothing has really, not until right now,
Nothing's really worked.
No. And there are a lot of chronic pain symptoms that you've had that you first came in with about 2 or 3 months ago was your first visit with me.
Yeah.
And you went through that protocol that wasn't too hard to complete.
No.
That was
pretty
easy.
straightforward, easy going.
Pretty easy going.
Yeah.
Just busy doing it, but not okay. And some of the symptoms that he's got, well, let's talk about what has actually gotten worse, or a symptom that was gone before but now came back following the protocol, is you got some achiness in the shins.
Right.
Is it a burning? Is it a dull?
It's kind of, the only way to explain it is like bone pain, like a bone ache.
Okay, like a bone pain. So sometimes the bone itself can have infection, but sometimes, and what I didn't share with you before, is that another area of the body can be reflexing down. 1 area, 2, 3, 10 areas. Stomach can be infected, a testicle can be infected, the prostate can be infected, the cheek gland called the parotid gland can be infected, and it makes you feel, you perceive that there's shin pain. Well, that's a possibility too. And what we had also with you was that the pains, the nerve type pain, how would you describe the pain that you've got all over the body?
It's like a burning, searing sensation all through the body.
And that still has not changed in the last round?
No.
Okay. What has changed in the last round is that when he stands for a long period of time, one of your symptoms was that your feet turn purple?
Yeah. What did the doctors call that? They call it POTS syndrome.
Yeah.
Yeah.
Well, that would really be going on with a tachycardia, but they're saying that the blood can't go back up to brain is basically
exactly,
what they're saying.
yeah.
So the blood pulls down to the feet, and this time, what we did after this round, you noticed that
my feet don't turn purple anymore. And they're not cold, and my hands aren't cold anymore.
So hands and feet were really cold, even living in Canada in the cold or the warm weather, and you're not too sensitive to cold weather anymore because you're a Canadian, but your hands and feet were always cold.
Yeah, and 30 above weather in the summertime.
And how many years were they cold for? Feeling that strange cold sensation in the hands and feet?
Probably 6-7 years.
6-7 years, and now they're not cold anymore.
Right.
They feel normal temperature.
Yeah.
Excellent. You had a urinary frequency of urination, and that decreased?
Yeah, I was going probably every hour on the hour, and now it's like 3-4 times a day.
3-4 times a day.
Which is normal.
Yeah, that's awesome. And you're still drinking enough regular fluid intake, and okay, so there's no change in that.
Drinking tons of water like a good Lyme patient does. So.
Yeah. Let's see. Another one was the, if I may bring up something personal, and some other men have this, and some men who are listening, or some women who have husbands or boyfriends or fiancés or friends or significant others who have had a dysfunction problem with getting an erection or maintaining an erection. And we know from the research that I do and the work that I do and what I offer for people is that infection can get into the penis, it can get into the testicle, it can get in the epididymis, which is a maze type of cord that connects from the from the testicle into the spermatocord. Infection can be the point is, it can be in the testicle, it can be in the penis, it can be in the prostate, it can be anywhere in the reproductive tissues in a male. And since what we did in the last round, you noticed that you have a bit of better function down there.
Yeah, like it's not 100% yet, but it's greatly increased
in your ability to actually get or maintain.
Yeah, exactly.
But not normal yet, but we're getting there.
Yeah.
You also had very frequent, almost daily or nightly night sweats.
Yeah.
Before, and that was a daily or a nightly basis.
Yeah, it was usually at night.
I said night sweats. I don't know why I said day, but it was.
Yeah, it was night sweats. Yeah.
Thank you.
And it's the doctors told me it was from more than probably from the Babesia infection that I had. So
And right now, in our last, what we did with the last round, you said that you have no more night sweats.
no more night sweats.
Eliminated
Gone.
completely. You were before, and there were a lot of symptoms that you came down, but let's touch some highlights, a few more. You had, you were pretty nervous and emotional, is what you reported to me before you came to my clinic the first time.
Yeah, anxiety for no reason at all. When there was no reason to be anxious at all, and that's pretty improved. It's pretty
You said
much
about
gone.
50%, but you're noticing
Yeah.
a great relief in that. You also said that when you would rest, lying down, resting, there was a increased heart palpitations or increased heart rate would develop just by lying down.
Yeah, that's improved as well. It's pretty much gone away now that I don't have the heart palpitations, which people with Lyme and co-infections understand a lot, that they're
Sure.
always going to cardiologists to figure out what's going on with
And the
them inside.
cardiologist would run heart tests with you and stress
It would
tests?
be
or have
normal
those, it'd be
and-
normal.
Yeah,
But you'd always feel, hey, my
Yeah.
pulse rate goes up and my heart rate's going up and
Yeah.
I can't.
I'm not imagining it.
Yeah.
It's actually happening. Yeah.
And your memory has improved?
Yeah, I actually my short-term memory was pretty poor, and it's actually improved a lot now. I can remember things now, so
Okay.
can't use that excuse with my wife anymore. So, yeah.
She's going to hear this and she's going to
Yeah, I know.
You also said that reading and driving would create a lot of fatigue.
Yeah, like driving, like if you had to drive like a long distance, like half an hour or something like that, that would wipe me out. Or if I read for more than an hour, it would kind of wipe me out. My brain would get tired almost, it would seem.
And
Yeah.
that's
That's improved a lot. That's
improved.
gone,
Okay,
yeah.
awesome. And hopelessness, you're not.
No,
Definitely.
well, I've always, yeah, you get hopeful, like when you've been sick as long as I have, you get that hopelessness type of thing, and that's starting to slowly go away as well.
Do you think it's going away just because you're feeling relief of certain symptoms, or you feel like it's going away because you feel like somebody you're with is really able to get it done for you, or what do you think is going on with that?
I think
Decreasing
it's a little bit of everything.
that? Okay.
Some improvement in the symptoms, but also knowing exactly where the infection is and where it is in the body. With a lot of Lyme treatment, it's kind of guesswork, because there is no 100% test in any of these infections, so we don't know where they are, and that's why people go into remission, then all of a sudden they're sick a month later after they get off the antibiotics. So
Yeah. And it's not even not only have you not been able to, or other methods that you've been to, or other people that you know who have Lyme and other things, they haven't. Not only do they not know where the infections are, but they don't even know what level of infection it is in a certain tissue.
well, exactly. Like, I mean, for example, let's say Bartonella, doctors just guess, well, you got Bartonella-like symptoms, so we'll just treat you for Bartonella and slam you with this many antibiotics and hope for the best that the symptoms go away.
Oh, horrible.
Same with Babesia. You have night sweats, well, you have Babesia, so we're going to put you on anti-malarials for 6 months.
So there's still, it's just a wild guess.
It is a guessing game.
Guessing game, and it's like pin the
Yeah.
tail on the donkey is the term I use.
It is kind of a comfort to know exactly where the infections are and where they are in the body. Otherwise, it was just like chasing shadows.
Yeah,
Yeah.
awesome. And when you're saying that to know where they are is because with the type of work that I offer and what you're experiencing now is that we can actually pick which tissue the infection's in, how much of that. Basically, we'll say how much, but how strong of a remedy, how strong of a potency of a remedy has to be used in order to knock that infection out of that tissue.
Right.
If you have a strong enough immune system, if we need, there's various things that went into this.
Yeah, it's just like even parasites is like you can have a stool sample and it's full of parasites and it comes back negative and you can see the parasites floating in your toilet bowl and the doctors are like, okay, we'll just put you on antiparasitics and hope it goes away.
Yeah.
And that's essentially how the
No
treatment
hoping.
is right now.
No. How the treatment is out there with other
Yeah.
physicians right
Yeah,
now. Not here.
exactly,
Not
yeah.
here with me right now.
No, like yours is more exact. This is the first. I've traveled the world trying to find cures, and this is the most exact I've ever had. So
Excellent. Thank you for saying that. And in this round, I want to cover some things. Let's go back just a moment, if we can, and we're just going to go through. In his last round, when people say, "Can I get better? Will it help me? Will it work for me?" And And when will I experience relief? In your case, I'm actually quite happy with the progress that we've made. In some cases, they don't even feel this amount of relief. They might only feel one symptom decreased by 10% or no symptom relief just yet, because now we're setting the stage to be able to clean out certain infections from tissues. And why I say that is because it's in your first round, the majority of these stressors were plaguing the immune system's ability to fight the infections and to deal with other infections and toxins in his tissues. And we had to be able to remove these stressors from his whole reticuloendothelial system. And there were many different infections that came from his travels around the world. I mean, yellow fever, filariasis, rickettsia, malaria, St. Louis encephalitis. He had hookworm and multiple parasites and mycoplasmas, and the list is really long. But that had to be taken away from that immune system, or the RES, or reticuloendothelial system, to be able to let your immune system be able to start carrying out certain functions in other areas of the body. He also, it was very interesting, which I do find with, and this is not pointing the finger at you, but although it is a finding with you, but I do find with, what I found in you, was a very high level of Borrelia burgdorferi in the diencephalon of the brain. And the diencephalon of the brain is an area of the brain that actually developed all other areas of the brain. It's going back to like embryo stages or fetal stages. And that had to be dealt with to allow that part of the brain to be able to start to tell other parts of the body how to function. In this round, what we found with him on re-exam was that everything was clear in that last test, just about clear, because the vas deferens, which is where they do a vasectomy inside the male reproductive area, the vas deferens, we were only able to go after the Borrelia with a very small remedy, which is a very potent one, but it was only enough that your body could handle. And there was some babesia and mycoplasma in that vas deferens. This test, we went back and tested the tissues we treated before to see if they're clear. And the vas deferens showed up again. And this time, it went from a very minor potency level, which in some cases, the minor potency level is perfect to just knock out that infection that meets that same size of infection. You follow me?
Yeah.
But in this case, it was a gigantic infection of that Borrelia that we could go after in that vas deferens. So it's like the body woke up and said, now I can actually get rid of that whole infection that's down there.
The one thing I'd like to point out to like the Lyme community out there is that these treatments aren't as painful as antibiotics. You don't get the Herxheimer reaction that you do with antibiotics. So it's a lot more gentler process, but you still get the same effect. So
the same effect, or a
you're
better
getting
effect.
the effect.
You're getting the results.
Yeah, you're getting
but you're
results.
not getting the Herxheimer. You're not feeling that whole.
Yeah, you're not like basically wiped out in a bed for like
Sometimes that can
weeks.
happen to people. It didn't happen to
Yeah.
you, but other people do get a washout experience where they could feel some pain or something go through the heart, and the heart can feel pain. They might get a little headache. They actually can feel really wiped out. There are some people who actually do feel like they can't get out of bed for a couple of days with this, because the body has to go through has to use a lot of energy to do the job to fulfill the requirements of fighting these infections.
But
So
like
for you, I'm happy that it didn't happen that way, because
but the difference between the wipeout with this and in IV antibiotics is night and day.
night and day.
Yeah.
Okay, good. And you know better than me, because I've never had that done with me. We found in the vas deferens that he has periodontal infection down there, major Lyme infection down there, the Borrelia burgdorferi. There was also dental amalgam, so we've got one tooth that he's going to handle with the dentist. He's got a crown on that tooth that he's got to deal with. We can't clear that out yet. He also had in the epididymis, down in there in the reproductive area, is Lyme infection, periodontal infection again, more mercury from the teeth, a huge amount of the Bartonella henselei infection, and you knew that was going to come up somewhere in the system, in your body, that we had to go after. Mycoplasma, babesia, ringworm. Also in the spermatocord, there was periodontal infection in there. In the testicles, periodontal infection. In the Peyer's patches in the intestines, these are Lyme tissues that help us, in the intestine that help us, named after Dr. Peyer. They're patches of lymph tissue inside the intestine that help us remove infection and toxin. And that was also loaded at a much higher level of infection from the mouth that's down there.
Right.
And we did do an exam on him with his mouth last time that he came down, and there was Lyme in the teeth, and the roots of the teeth, and the jawbone, and
I think I had Lyme in every single tooth.
everything in the gums and Bartonella and Ehrlichia and Babesia, and it was just, it's all around the mouth. So what I understand, and I think what I shared with you last time, is that the infection in the body can travel up a blood vessel, up a nerve, and go to the mouth.
Right.
It doesn't necessarily mean that the infection was here and went down. But the infection can go from the mouth to the body. It can go from the body to the mouth. It could have gotten in there from the time he was, before you were born. Maybe you were born with some of these infections. Maybe your great grandparents in your history, all the way down when you run your family tree, maybe somebody else got infected along the way and it just passed through generation after generation. But there's a number of ways that infections can get in the body. It's not always from a tick bite that a Lyme can get in there. We'll talk more about that in another video. But so far we've made some progress. Pretty happy about the progress. And we've got more to do. I think this round is going to make a huge dent in all of the symptoms that he's dealing with, because one of the main symptoms you have is a burning pain down in your reproductive area.
Right.
And that's been going on for a pretty long time. So once we get rid of these infections down there, I think that's going to just subside to such a tremendous degree. Hopefully it'll be all gone completely. And I won't see him again for 30 days. So we'll touch base again when we can get an update from him. But so far it's working for you, and we're glad you made the decision to come down here.
Yeah, so far I'm happy with the progress.
Okay.
By far, yeah.
Thank you. Thank you for sharing. You can anybody who's suffering chronic condition, anybody who's suffering chronic fatigue and chronic pains, our clinic number for consultation, it's 954-370-3100. Subscribe on this YouTube channel, and also share this video with a friend, because there's somebody out there who you know, or somebody who you know who knows someone who is terribly ill, who needs to get better, and the job can be done and it will be done. We just have to use the right tools. Thank you for letting us come in and share this with you.